welcome back to another one of our Accreditation 360 events. This is actually going to be part four of a discussion about the survey process guide, which is pretty amazing that it's going to take multiple parts. We're in the fourth one. I don't think we're going to get finished. I think I know we're not going to finish today with this one, but we appreciate everybody joining us. We appreciate your feedback. We've gotten some great feedback about these, and we're incorporating a lot of that, going with some of the future events that we have planned. In fact, we're gonna add some. If you go to our website now, you'll see that we've got the schedule for the rest of the year. And actually, I'm going to call that a partial schedule because we're going to add a few events to that are going to focus a lot on the physical environment. We'll talk about that a little bit later. But I'm happy today to have two of my favorite people join me on the screen. Ramona Cheek, it just makes everybody's life better when she shows up and smiles. And Edwin Lofton, who everybody knows by now through these events. And I just want to talk a little bit again about, th- well, well, I think it's, let me throw a theory out there and let you guys reject it if that's where we want to go. But with this whole national patient goals, performance goals, I knew I was going to do it. I knew I was going to, at least I got a hybrid between national patient safety goals and national performance goals. Um, there's really, I mean, because this question keeps coming up, there's not a whole lot of new, right? But it's a whole lot of change still. It's like a movement of items. There is perhaps an additional, a renewed focus or enhanced focus on performance. And is that a fair statement?
Yeah, I would say, and I think that we've said all along, that there's a new emphasis on the COPs and how they're doing it. And then Joint Commission added a spin and said, hey, if you want to be Joint Commission accredited, there's some things that we think are very important that are not included in CLPs. And we're going to put all those things together in a new chapter and call it the National Performance Goals. So I think that that's what they've done at the beginning. I think as they get used to it, there's going to be more additions. I think as CMS evolves, and because I do think that there's going to be some evolution in CMS, hopefully, that you'll continue to see more changes as people become more focused. But I think it's going to be interesting for us all to kind of see how Joint Commission surveys. So if you pass all the COPs and you don't pass the national performance goals chapter, what does that mean? Does it mean
Right.
that you have deemed status but you aren't Joint Commission accredited? And is that going to be um, a new survey certification or accreditation standard? What is it? I want to say standard or situation. So I think that we're just into some interesting times.
Yeah. I
Yeah,
mean,
I
it's,
agree with everything Ramona said, and I think in addition, especially within the national performance goals, the Joint Commission, along with CMS, is reemphasizing the ownership that leadership and governance has for outcomes, mission, vision, and PI throughout systems.
yeah, which seems like the right thing to be doing right now, right? I mean, I can't disagree with that emphasis coming from them. But Ramona, I think you touched on it. It's like, I think we really don't know yet. I don't even know that, well, they probably know. I don't know that everybody within their organization knows at this point, at least from some of the interactions I've had with some surveyors. They're still trying to figure this whole thing
Yeah,
out where it's going to
yeah.
be. We've got an event coming up in just a little over a month where we'll have a chance to really engage with them, and see what happens. Hopefully we'll get some deeper insight into that. But at this point, we're looking at what we have, which is the pre-publication standards, and we're doing our best to evaluate those and go, this is what we think is going to happen. But what we're finding out, and by the way, we appreciate everybody who gave us feedback regarding, I think I asked a question about would you guys like some short videos that are pushed, aimed directly at leadership, and got some resounding yeses out of that. So we're going to be working on that here in the near future. Um, but so today, though, this part four, we're going to talk about really two things. We're going to talk about the national performance goals, particularly how the patient care module, which used to be chapter, interact is involved in that. And then we'll talk a little bit more about the survey process guide. But uh, so just kind of in general, I mean, how's this rewrite affected this patient care module. I'm working on the new terminology.
So this was a fun one to do and a fun one to read, because the patient care, the provision of care, treatment, and services, that's probably one of the longest Joint Commission chapters. So I just did here's some fun facts. See if people enjoy these facts as much as I did discovering them and reading them. So in 2025, there were 47 standards in the PC chapter. In 2026, they've reduced that to 31 standards. So in that, they've deleted 62 EPs, and some of those. Now, see, it sounds really good when you say that. Gosh, 62 EPs were deleted. But wait, there's more to the story. Of those, 42 were deleted but replaced with more direct EPs or moved to the guidance in the survey process guide. And then 13 are going to be, 7 totally deleted, 42 deleted and replaced with more direct EPs or moved into the SPG guidance. And then 13 are going to be replaced with more direct EPs with CMS approval. So they're still waiting to add some more pending CMS approval. Most of those revolve around maternal standards. And we already heard previously that they're doing some changes with looking at those maternal standards. So that's not new. So of those EPs in the PCs, 4 were moved to completely different chapters. So they moved from the PC chapter to 4 different Joint Commission chapters. 1 went to record of care, 1 went to rights and responsibilities, 1 went to nursing service, and 1 went to leadership. And then they have, and this was fun to do because I just took it and color coded everything. So of those, they moved 26 of those EPs to the National Performance Goal chapter, and Ed will talk more about that. And of those, when they talk about it, they moved 24 of them. They call them moved and revised. 1 was just moved. So those, I take it, when I read that they're just moved, I would say that their language matches word for word with what the COP's language is. So when they just say moved, so they just picked it up and moved it, and it remained, had the same language. And then they moved and consolidated 1. And that's an example of consolidation is under patient identification. They had one just under general, how do you correctly identify a patient? And then they had the same standard or the same EP for how do you correctly identify someone that's receiving blood. So they consolidated that into 1 EP, which makes sense, and I think is great.
Yeah.
But the bulk, they renumbered a whole bunch of them, but they remain in the PC chapter. So of those, 102 were renumbered but remain in the PC chapter EPs. 60 were moved and revised, meaning they had some language tweak. 32 were just moved so that the language matched word for word with the COPs, and then 10 were consolidated. And of those that were consolidated, most of those had to do with the plan of care. And then there's still more. There are more, they have some new EPs under the PC, and that came from, they're just aligning their language to align more closely, and I would say word for word with what the COPs say. And of those, when I delved in, I didn't read all of them. It's just, sometimes the language gets a little bit boring, but of those, I know, I can't believe CMS sometimes gets boring. They have to work on that. I think they should hire me as a writer. It would really make it and liven it up a little bit. But anyway.
I would vote for that.
Yeah.
But of those, most of those have to do around the plan of care. The ones that they're rewriting. And I want people to pay particular, because language is important. And CMS language is especially important. And one of the things that they're emphasizing, and I think we talked a little bit about this, is that the hospital involves the patient in the plan of care. And they're looking especially how is that involvement and how do you document that involvement? And I think what most of us would always, especially from a nursing perspective, we always involve the patient in the plan of care. But I'm thinking that they're wanting something a little bit deeper in that patient knows what that plan of care is, and what it says and what the goals are. And usually we've surveyed that plan of care by asking the nurse, what are the plans? What was your assessment? What were your interventions? What's your plan of care for that particular patient? And the nurse answers it from her perspective and her documentation, not necessarily with the patient being able to verbalize everything that was on the plan of care. I think that they're expecting a little bit more involvement with that. Now, some things might still count. For example, when you go into the room and there's a care board and you see that there's a discharge goal, right? The patient is involved in that. That goal is right there. It's written. The patient can speak to it. But I think that CMS, especially with emphasizing that the patient's involved, is looking for a little bit more, that the patient has a little bit better understanding of the overall plan of care and what they're doing and goals of care. And actually will help set some of those goals. We've had a little bit of practice that with the pain goal. I mean, we're very used to asking the patient, what is your goal for pain relief, and involving them in that way. I think that they're just expanding on that picture.
Yeah. Gee, Ramona, I wish you were a little more enthusiastic about this stuff. I was sitting here thinking, it's like, well, if you're watching today, you got a cocktail party or something you're going to this weekend, you're wondering what you're going to talk about. Ramona has just like totally loaded you up with facts, fun facts to discuss at your next
Yeah,
social
on
event.
the PC
But
chapter. Yeah.
I'm like, gosh, we're nerdy.
And and,
But
and Ramona, you're spot on. In fact, in the survey process guide, the interview questions that the Joint Commission surveyor is directed to say, and you and I have said this before in previous sections, this is now a much more prescriptive process. The interview questions around the plan of care actually goes through three ways. It goes, the surveyor will ask the patient or their family member, how were you involved and how did you have input? Then they'll ask the nurse, how was that input incorporated into the nursing care plan and how was that affiliated with the physician plan of care? So it really takes it from the medical side to the nursing side to the patient centered side. So you're spot on.
Yeah, and I think one of the things too that we know we got from when we first looked at the survey process guide and the what they're doing around the beginning of the survey is that they're going to emphasize that point with CMS surveyors are getting to talk to the patient alone, the patient and family alone, and the staff alone. That's not really has been Joint Commission style in the surveys. Usually, the surveyors have been very open and transparent, and when they ask the question, they've asked with other people present, you know, with the escorts and the leadership staff present. But there might be a difference now that we'll see that they're asking those questions alone, without anyone else being present and scoring based on what the answers are when there's no one present. So that's a little bit different too.
yeah, I mean, I'm just kind of thinking about my own personal experience as a patient and being, uh, you know, you're kind of in shock during that experience. I mean, I'm just wondering how many patients are actually going to be able to respond in a really articulate way,
Yeah.
given the circumstance. I mean, I wonder how they're going to, I guess what I'm asking is how are they going to account for that situation where, you know, the hospital's made every effort to involve the patient and the patient's just kind of checked out emotionally and just uh, stuff we'll guys will figure out as we go.
Well,
So
and as back to what Ramona was saying, I think a lot of that is going to, we'll see how that evolves over the first 6 months of surveys. Is it going to be a natural fit? Is it going to be able to be pulled out just from a private conversation with the patient, or does there need to be a team conversation since it is around patient centered care?
but I mean, I think that all that is a step in the right direction there. I mean, it makes perfect sense to me. Um, so, I mean, Rona, you did a really good job of kind of summarizing where these patient care standards and EPs have been reorganized and moved. And is there anything else you want to cover about that? Or, I mean,
No, I think generally that's the overall. I mean, so you know, in theory, it looks like they've reduced the number of standards, and they have, and they've consolidated and reduced the number of EPs and clarified them. I think it's going to always be a work in progress, but I think the emphasis in how they're going to score and for those might be a little bit different than what we've been used to in the past.
Yeah, it's almost more of an efficiency thing than a reduction thing
Right,
from what I'm hearing you say, right? And
right.
so which hey, that's good. It makes it a little bit easier for everybody, hopefully. It'll be interesting to see how these evolve over the next year, 2 years, 3 years. As I'm showing my age here. Of course, the gray hair is doing that for me, but that we've been kind of through these major standard changes before, and no disrespect intended in this statement, but they tend to sometimes they go a little too far and they have to kind of adjust back, and then you reach that equilibrium. So I suspect that's going to be going on for the next few years. But we'll see, and we'll have more information certainly here, like I said, in a couple of months. But so let's talk a little bit about the survey process guide, and specifically the patient care module. Again, working on my new nomenclature. So I mean, how are we? How do those standards fit into the MPG, and what's the process going to look like? What do you
So
think?
when they moved, and everyone will talk more. When they moved those the patient care standards and EPs into the national patient goals, they were deliberate because each there's 14 different national patient goals, which Edward will talk about, and they moved those into 6 specific different chapters to kind of give you an idea of what those themes are around. I think that they're trying to consolidate and have themes so that people can so that it makes sense. In the revisions. And so I'll turn it over to Edwin to talk a little bit more about that fun process.
So thank you, Ramona. And as Ramona said, 24 EPs were moved over from PC into the National Performance Goals. And I'm going to try to not slip on my language, and I'm going to use NPG, knowing that that's National Performance Goals. Of those 24 EPs, they make up 7 standards from the old PC chapter. And I'm going to keep it at a high level now, but I think it will paint a picture for the audience of where to look at. And then I'll touch base on the survey process guide. The PC standards that were moved over to NPG related to pain assessment, fall assessment, assessment for abuse and neglect. A grouping was moved over into diagnostic testing. There's actually been some quite expansion of diagnostic testing, laboratory, and what they're calling now affiliate services throughout the care spectrum. Standards related to resuscitation and care, and how you assess the patient and look for changes, acute changes in their pathophysiological status, how you respond to the need for resuscitation and care, how you educate for that, and how you assess the effectiveness of that education. And then also and this is one of the ones that Ramona spoke to of consolidation, it was around communication about care. So those are the groupings that have been moved from PC over to NPG, the National Performance Goals. I'm going to go with a fun fact too, Ramona. I won't be as extensive or lively as you were, but I was reading the survey process guide this morning. And remember that the survey process guide went from, I think it was like 147 pages in the current 2025 grouping, and to where now it is in excess of 650 pages. So that's where we get the term prescriptive, because they are very specific in interview questions. Specifically related to NPG, there are 35 pages. 35 pages on this one module with very prescriptive interview questions, documentations to look for, and evidence to look for. And I'll give you a couple of examples. Related to NPG 060201, which is your pain standard, it is how are you as a hospital collecting, evaluating, and using the analysis of patient level pain data? How do you manage that pain? What's the effectiveness? And how do you assess and document safe opioid use? And there's a trickle down under each one of those. Those are just very high level components. And related to falls, what is your evidence-based assessment tool for risk? How are your interventions carried out? How consistently are they carried out? How do you use performance improvement in evaluating the effectiveness of your risk prevention tools for fall review? How do you do the document review? And this is where they come back into patient level interviews and talking to patients and families and how were they involved in the risk assessment and knowledge of why certain tools were put in place. And then back on the communication component is how was information provided to the patient and their family in a manner that they wanted to have? This goes back to some old standards. What was your method of teaching, and was it effective for the patient and the family? But now they're broadening it into the communication standpoint of what how I talked with, how I provided written information in a way that the patient and family understood and wanted it. So it is a global perspective. That we've used the term several times around person and patient centered care.
So I'm going to just ask a crazy question here. The prescriptiveness of this, we've kind of been down this road before, way back when. And let's just take this one example, the 35 pages where they've given specific interview questions. What that says to me is, as a hospital, as an accredited organization, I can look at those prescriptive interview questions and come up with very thoughtful answers to those questions, and then and be prepared for that. And so we used to do that way back, right? And then they came up with the tracer methodology and everything that sort of made it more difficult for us to have sort of a pre-prepared response to everything. How do you think they're going to reconcile that? Or do we know yet?
Well, I think that CMS has always been very prescriptive. I mean, so anyone that's had the pleasure of having CMS come in or your state surveyors come in are used to kind of that prescriptive, no nonsense. They're looking for certain things. There's not a lot of talking, not a lot of collaboration, not a lot of education, not a lot of consultation. I think what's going to be very different is seeing that from the Joint Commission surveyors and having the Joint Commission surveyors adopt that persona. That's a very different way of how they're used to surveying. They're used to coming in, being more education consultative. They always look at stuff, but being this prescriptive and having to fill out this many checklists is going to be a little bit different. I think for both the surveyors and for the hospital that's receiving it from the Joint Commission end. I think it's going to be an evolution. I think that we'll
Yeah.
figure out. I mean, I think at first it's going to, and it depends on the surveyor. Some Joint Commission surveyors, if they've been around, might love this new prescriptive way, no nonsense, get in, get out. Some are not, and I think it's just finding their new groove with this.
Yeah, I was thinking the same thing. I mean, it's like anything else, right? It's going to major changes in the process are going to resonate well with some and not with others. And there may be some that I don't want to say survive and others that don't, but some that hang in there and others that decide to want to do something differently. And that'll be interesting. So that's a good point, though. CMS has always been that prescriptive, and I'm sure that is what's driving a lot of this. So. Um, it's going to be an interesting first quarter of 2026.
In days past, in my day, that's why you picked Joint Commission because you didn't want the prescriptiveness and kind of the harshness of CMS. That's why you chose to go through Joint Commission for your accreditation and for their deemed status because you like the style of Joint Commission better. So it is going to be interesting as the styles merge a little bit. What's a differentiator going to be then?
Yeah.
And Steve, as you said, it's the swing of the pendulum. From a hospital perspective, we've complained about Joint Commission for years because every surveyor would bring in their subjective evaluation, and that goes way over here. And then you go to CMS, and as Ramona said, their CMS has always been very prescriptive. So it'll be interesting to see where that pendulum stops in the middle between an interactive educational tool to a hardline ABC black and white.
Yeah. Well, I think we're gonna find out together, that's for sure. And then we'll stay on top of it. And that's one of the reasons we're doing these things in such a regular interval, and we'll plan to continue to do them as this evolves and we get, can refine our story a little bit based on real world examples. I think it's a good thing that we've got a couple of hospitals that are going to be surveyed early on, and they may not be as happy about it as we are, but it is what it is. So, anything else you guys want to talk about in terms of particularly the patient care module, or and how that's going to impact national performance goals or survey process guide? I know we're trying to keep these things to 30 minutes, so we got about 5 minutes left, something like that.
So I think, again, back referencing to what Ramon has said, read between the lines. As standards and EPs have been moved into other chapters, some things have been moved to leadership. That is something that we've seen across the board, whether it's PC or other modules. As I said early on, there is an emphasis on leadership and governing body owning the outcomes of healthcare systems, and that's something that every organization has to really understand.
Yeah, and I would say for the PC chapter, it's always been about the provision of care, treatment, and services, and that is something that those at the point of care excel in. I think they know it. They always have known what it is that they do to take care of patients, to keep patients safe, and to provide quality care. It's just helping them articulate that in a more standard manner. I mean, they know it, they have it, they've got this. It's just learning the new language of how you articulate what it is that you've always done.
Yeah, I mean, it comes down to if you're doing the right thing, you really got nothing to worry about, right? I mean, if
Bingo.
you're doing the right thing for the patient and for everyone else involved, all the stakeholders in that patient's care, I think. But you're right, articulating, I think, is going to be more important than it has been in the past.
Right.
Um, and so we'll just have to work on that with them and others. So, well, again, I appreciate you guys being here and giving us your time, and I appreciate everybody tuning in for another one of these. I just want to remind everybody that you can go to our website, see the schedule that's coming up. You can view the ones that we've already done. This is the sixth one now that we've done. See, and time is flying. That's been 12 weeks, right? If you do the math, right? Wow. So you can watch the previous ones. You can sign up for the ones that are coming. We're going to be adding some of those to the list. If you're an ARN member, you can get certificates of continuing education certificates. That was easy for me to say. Give us a little bit of some time there. We have working with Kirby Bates. We have to uh, get the recording and then get them to approve it and everything. So I bet we want to make sure you take advantage of that. So anything else you guys want to add before we close it out?
No,
Look
it's
forward
been
to
it's
seeing you
been
next
our
time.
pleasure.
Yeah, thank you both. Enjoy the rest of your day, and look forward to seeing everybody here in 2 weeks.
Okay.
Take care.